Hello and welcome to another edition of Medical Today. I'm Gerard Ratnam. Firstly, from all of us here at BNC, Selamat Menyambut Hari Merdeka. On today's show, we'll be taking a look at abnormal vaginal bleeding. We'll also be taking a look at epilepsy. But for now, what we're going to do is play you a repeat of something we recorded some time ago. And this is with regards to HFMD. By popular demand, we're bringing it back. It was an interview. I spoke to Sharifah Fauzia, a pharmacist, and she's also in charge of regulatory affairs in Pharmaniaga, Sdn Bhd. So let's take a look at that interview with regards to HFMD. Well, it's been in the news. Everyone's been talking about it, yes. HFMD, and I guess it's only right that we talk about it. And basically, when we talk about it, to take away all the stuff that's too technical for people, give us a better understanding by just knowing the basics. Yeah.
Mm-hmm.
Yeah.
Yes,
so when we talk about HFMD, let's start with what is hand, foot, and mouth disease.
Okay, hand, foot, and mouth disease, HFMD, is a viral infection, and it affects generally younger children, say under the age of 5, and it's generally demonstrated through these symptoms: fever, blisters in the mouth, which can also appear on the hands and the legs, the foot, as well as poor appetite and acute. It can also happen acute diarrhea and vomiting.
Well, it's very interesting that off the air we were talking about this, and you did correct me. I was saying about how it is come about with so much news surrounding it, and how it's there's an exponential growth in the rise of it. And you said there's not an exponential growth, but people, it's just that we talk more about it now. Yes, how do you better explain this?
Basically, I think foot and mouth disease, the virus, for example, has already been there. It's always there. It's just that how it is being communicated, from one person to another. And yes, there is an increase this year. I think, if I'm not mistaken, the figure is about 20% increase from last year. And I guess because the basics of managing HFMD is basically through cleanliness. So I think we need to take a look at how we manage, cleanliness of the individual, of the environment, and the whole.
So for me to say that there's an exponential rise is not too correct. I said growth first, said that's bad. An exponential rise, that is not true. So all of us are talking about it, hence that's why we think there's a lot of cases happening right here in the peninsula, also in Sabah and Sarawak. Now, let's talk about what causes it, the causes of HFMD.
Okay, basically I mentioned earlier, it's a viral infection. There's a virus from the group enterovirus, but within this group of enterovirus, there are several different types of viruses. So, for example, there's Coxsackie virus, EP13. So these are examples of viruses that could cause HFMD. But there are also other viruses within the same category that doesn't cause HFMD. Generally, it's caused by EV71 and Coxsackie A16.
Now, once someone's exposed to it, how does one contract it? What kind of exposure leads to contraction?
Okay, it depends on individuals. It can be as early as 3 days and as long as 7 days. So within those 3 to 7 days, what we call as the incubation period, the the person may not manifest anything, but after 3 to 7 days, then the first symptoms will start to appear, which is normally fever.
Okay, so they say, you have to be careful because you or your kid may pick it up in a shopping mall.
Yes.
Does that have any truth to this?
Yes, yes. Actually, yes, there is a lot of truth because the viral infection is contagious. And it is spread from one person to another, actually through direct contact. One, direct contact either with the discharge, I think I've got this here, either discharge from the nasal discharge or the saliva, or fluid from the blister or the rash, okay, or direct contact with the stool. This is especially for caretakers, right? Or it can also be direct contact with the surfaces. So we're talking about, if you're talking about kids, if they touch the toys or maybe even door handles, so you can actually contract it, getting it by touching all of these infected or contaminated surfaces.
So people who work in the service industry and people who work in hospitals, their kids, are they more prone to or susceptible to it?
Yes, they would be in a higher risk because their parents would probably be carriers, but it is very important, like I said earlier, cleanliness is very important. As long as certain level of cleanliness is maintained, I don't think they should be worried about it, basically.
Right.
Yeah.
Now, when we talk about cleanliness, let's go back a little and talk about seriousness. Okay. So then we'll come back to cleanliness.
Okay.
Now, how serious is this problem?
Well, generally for most people, HFMD is a mild infection. Okay, not a very small percentage actually get complications from the disease. And I think for this year, we've recorded about cumulative numbers from KKM is about more than 44,000 cases since January. But we've had 2 unfortunate deaths.
Right.
So, but these are those that actually develop complications. But otherwise, once you get it, within a week or maybe maximum 10 days, it'll go away.
So the ones that develop or people who are prone to complications, what kind of complications are we looking at?
The complications can be in a form of viral meningitis, and that could also lead to respiratory issues as well as cardiovascular issues. Yeah.
Now, treating the disease or the virus or the symptoms, how do you go about doing it?
You don't treat HFMD. Okay, there's no medication to treat it, nor are there any medication to prevent it. But what you do is, normally what clinicians do is they would treat the symptoms. So I mentioned fever, so you treat the fever. Normally clinicians will prescribe the simplest form, paracetamol or ibuprofen, and you treat the blisters because that can be very very painful for the child. So you can treat them, especially in the mouth area. And for example, like Pharmaniaga, we do have product called Aftermat, which can be used
for symptomatic relief.
Yes, for symptomatic relief. That's right. And for the skin rashes is the normal. Maybe the clinician can prescribe just like calamine lotion, something to soothe the kid down.
So for a company like Pharmaniaga, it's very important that you collect data. Say this year, now that it's being talked about from January till now, does Pharmaniaga go out on a survey to collect data?
Well, data is very easy to be accessible right now through portals like the KKM portals. Yeah, that's where we get our numbers. But aside from that, what Pharmaniaga does, I think more importantly, is to advocate proper cleaning methods, proper how you take care of your cleanliness and your environment. And we have been doing that actually in the last couple of weeks. We've been actively declaring a war against HFMD.
Right, because it's just going out there and giving people more information as to what hygiene and cleanliness
correct. We give people information, and we actually have a poster where any schools or kindies or schools or nurseries can actually contact us if they need any kind of assistance with hand sanitizers. And we've also gone out to assist in terms of cleaning some of these sites.
So there you go. Pharmaniaga is lending a helping hand in giving out information about cleanliness. Most of us talk about cleanliness. Do we know what it is? This is Pharmaniaga's war on HFMD, right? So can you walk us through this?
Yes. So basically, we've put this poster up on social media, and any school operators, registered school operators or nursery operators can actually call us. Okay, this is the fax number.
Can I do my Patrick Theo radio voice for this?
Please.
03-3342-6629. It's 03-3342-6629. If you missed that, it's 03-3342-6629.
Yes.
Did I do well there?
Yes, you did very well. And so far we have received, I think, more than 500 requests. And we're in the process of approaching all these 500. And I think the numbers are coming in.
Right.
Yeah.
So coming back to cleanliness, most of us know washing your hands, okay? Washing your hands, washing your face, washing your feet when you come into your house. That's cleanliness for us. You know? So to move to get a deeper understanding of what cleanliness we're talking about with regards to the war on HFMD, what else do we need to do?
Okay, when you say wash the hands, it's not just simply making sure that your hands are wet, right? There is a technique to washing the hands. You need to at least do it for 20 seconds and make sure all the areas are covered with water and soap. And that is for personal hygiene. And aside from just washing the hands, we could use hand sanitizers, of course. Secondly is the environment. So the environment needs to also be clean. So we can also make sure that we sanitize the environment.
Right. The thing about hand sanitizers are, a lot of people think that, hand sanitizers, chemicals equals chemicals. I'm not going to use them. Now,
put it this way, you're not going to be using them
all the time.
Yes, right?
Correct.
So it is good to actually use for protection. But again, the proper hand washing is still number one.
Right.
That's still number one.
So proper hand washing, doing this
yes,
and this.
You know, make sure everything.
But if I do go to a hospital and I'm worried about contracting HFMD somewhere in the hospital, I need to use sanitizers there.
Yes, you need to use, correct.
Right. So there's no problems with that.
Yep.
But if you were to use it every day, then it may be harsh on the skin. So you also need to know that hand sanitizers play an important role in the war against HFMD.
Yes, correct. Yeah. But it doesn't rest there. Besides ensuring the cleanliness of the self and the environment, it's the third part is what you call as isolation. If you have a kid with HFMD, you need to keep him or her in isolation.
Right.
So that there is a minimum risk of...
So what about you? If you keep your kid in isolation, what risk do you pose to people?
Okay. For adults, the risk is actually lower because the risk is more towards children 5 years and below. Generally because number one, they have lower immunity. Okay. Secondly, they don't really take care of their own cleanliness. So to answer your question, a caretaker would have lesser risk in these two areas, higher immunity, and we take care of our cleanliness much better than the kids. So we shouldn't be not an issue.
Okay, so
for
saying
the children,
if
for the
I
adult.
have kids and my kid has HFMD, and I go to my sister's place, my sister has kids, you know, do they stand a chance from contracting it from?
Don't bring your kid. Leave your kid
just
at home.
Don't bring your kid.
Yes, leave your kid at home.
And cleanliness is of course important at all times. When you leave home, make sure you're clean. Any other advice for us before we close this segment with regards to the war on HFMD?
Yes, I think we've covered it all. The staying away from public places, and of course getting medical attention when the symptoms are there. Right? Don't just not do anything about it.
Stay away from public places. Get medical attention once symptoms are detected. Practice good hygiene. Disinfect your floor, your furniture and toys. And dispose of diapers properly. How do you explain that?
Because the virus can be found in the stool of the baby. Right. So you really need to make sure that whoever that's the caretaker that's handling the diapers needs to make sure that it is disposed of properly. So this would be more prevalent in places like nurseries, right? Yeah, where you have so many other babies, and you have.
So if you're running daycares or nurseries,
exactly,
you need to take this very seriously.
Yes, correct.
And last but not least, like you said before, that one Pharmaniaga has a war, has called for a war on HFMD. They're going all out. If you need any help, send them an email at comms, that's COMMS @pharmaniaga.com. or I'll give them a call or send them a fax at 03-3342-6629. This is Pharmaniaga's War on HFMD. On that note, we'd like to thank Sharifa Fauzia for joining us right here on Medical Today. We'll be back just after the break. Fauzia, thank you very much.
Thank you very much.
Stay with us. We'll come back shortly, right here on Medical Today, Bernama News Channel. Hello Malaysia and welcome back to Medical Today. We just came back from a break looking at hand, foot and mouth disease. Of course, that was a segment done before simply because there was a lot of people writing in to tell us that they wanted to view that again. So we decided to play that for you, a segment talking about hand, foot and mouth disease. From there, we move into another topic and we're going to be talking about epilepsy and the brain. And to join us in the studio is Dr. Shirini Bazir Ahmad, a consultant general physician neurologist from Ramsay, Sime, Darby Healthcare. She wears many hats doing the same thing. She's also the president of the Malaysian Epilepsy Society and the treasurer of the Epilepsy Council of Malaysia. Dr. Shirini, thank you very much for taking time off your busy schedule to be with us. Well, today we're going to be talking about epilepsy and the brain. Of course, you're going to be walking us through this, your area of speciality. So I'll get straight into it and ask you, what is epilepsy?
So thank you, Gerard, for having me here. So in a simple term, epilepsy is, imagine the brain has lots of electrical activities. So for epilepsy, there is an abnormal electrical activities in the brain that's causing brain to overfire. And this, as a result, can cause several symptoms on the patient.
Right, so there's a lot of electrical activity. It overfires. What causes the overfiring of brain activity?
When we talk about causes for epilepsy, there are multiple causes. The commonest one in Malaysia would be if there was any infection in the brain, of what people might call meningitis or encephalitis. Other than that, causes for epilepsy would be if there's any trauma to the brain, so previous brain injury, causing abnormal structure to the brain. Tumor is another cause for epilepsy. And of course, there were cases where people were born with abnormal structure in the brain, so what we call congenital abnormality in the brain.
People born with it are known as congenital, these are known as congenital abnormalities, yeah?
Congenital abnormalities, or what we call the abnormal brain malformation, so brain malformation causing epilepsy.
Right. Let's take a look at the at seizures and the main characteristics of epilepsy. Now, what are the signs of a seizure? We know, people get into a fit, yeah, we've seen that happen in front of us. So tell us what's happening behind this.
I think what people are more familiar with when we talk about epilepsy is the minute we talk seizure, then we think about fitting. So jerking movement of the arms and legs, biting of the tongue, clenching of the teeth. So this is what we call generalized seizure, or the old way of calling it was grand mal seizure. But I think
there's a lovely Malay word for it too, isn't it? In Malay, it's known as sawan, if I'm not mistaken.
Sawan, yes. Yeah. There are many names.
Yeah, and this is a true story because I have a friend, and I'm sure that person's watching it now. When he was small, he used to have these problems, and they brought him to a bomo, thinking that, yeah, he had some spirit in him, something like that. So back then, living in the kampong, things were a bit different. But I guess with all the information we have today, we know better now, yeah?
Yes, I mean, this is something that misconception about epilepsy is still here, is still there in the society. And this is what our role is as doctors and, people, non-governmental organization in epilepsy, trying to educate people to make them understand what is epilepsy and what actually causes epilepsy.
Right. I'm sure, I don't know if you have numbers offhand, but let's talk about the prevalence of epilepsy in Malaysia? Also, if you have numbers within the region and also around the world, if you have numbers for us, it'll be great. But what is the prevalence of it in Malaysia, firstly?
Well, in Malaysia, it's estimated about 1% of people, of our population that will have or has epilepsy. However, this might be an underestimation because I think there are a lot more people with epilepsy that hasn't come out and seek medical treatment. So let's say we have about 32 million of population. 32 million
so
you can imagine about over 300,000 people have epilepsy.
Of course, those numbers can be bigger than 300,000 if you're taking 1%.
Definitely. And this is the problem because people think that they are alone, they are suffering this alone, but they need to know that even around the world, there are about estimated 65 million people have epilepsy. And 80% of them comes from the developing countries or sort of like poor social economy countries.
Now, who is at risk of developing epilepsy?
Well, we mentioned about causes for epilepsy, so people who had previous brain infection, previous brain injury, congenital malformation. But there is a certain number of patients who has epilepsy because of their genetic preponderance, so genetic basis to it. But we need to realize as well there's a number of cases where we do not know why they have epilepsy. And I think this is an area which need a lot more research, and maybe, this group of people who we don't know maybe have some genetic factors to it that we still don't understand.
In the treatment of epilepsy today, what do we know now we didn't know 10 years, 15 years ago?
Well, I guess most importantly, what caused epilepsy? People, like you said, people bring patients with epilepsy to BOMO to seek like traditional treatment. And I think it's just the understanding what causes epilepsy. And epilepsy is a real disease. It's not something to do with being possessed. They can respond to treatment. And what we know about epilepsy now, there are treatment out there, and not just medication, that patients with epilepsy, if they have the right type of epilepsy, they can be cured with surgery.
Right. Now, if we're talking about age, at what age does epilepsy develop in some cases where people are born with it, when it's hereditary?
If we talk about age of onset, epilepsy can occur at any group of ages.
Right.
But if you're
so you can be well into your 40s, enjoying your life and have an onset.
If we talk about a genetic basis, then patients with epilepsy who has the type of epilepsy that's genetic related, they tend to have it at younger age. So they probably were born with it, have it when they were a baby, in their primary school years, teenagers. So these are the ones with genetic causes. So when we talk about more of adult onset or elderly onset, the causes are a bit different, and these are the patients that we need to really look hard for the cause.
Right. Now, with the patients you see on a daily basis, I'm sure there is a pattern to seeing patients that develop epilepsy and also problems with their brain. Now, are there abnormalities with cases that you see?
I have to say that the cases that I see
stuff that need referral work, you look at them and you need to talk to your colleagues and say, hey, what's going on here?
Definitely. So there's a group of patients that I see where that there is no surgical amenable causes. So some of them I don't even do an MRI scan. But there's a number of patients where I probably found a brain tumor. And I think what's important is the other thing that we are working towards is surgery in epilepsy. So people with, for example, abnormal development of the brain since childhood and suddenly develop epilepsy in their 20s or 30s or 40s. So we will do scans such as MRI of the brain, and these days we're not just relying on MRIs, we have functional scanning such as PET scan and SPECT scans. So we use this as modalities to help find where is the lesion in the brain that is causing the epilepsy, and this is when we need our surgical colleagues, neurosurgeon, to come and help us try to get this lesion out from the brain, hoping that it will cure epilepsy.
Right. We're going to take a short break, and of course when we come back we'll find out more about epilepsy and the brain. We're currently talking to Dr. Shirini Bazir Ahmad, who is a consultant general physician neurologist from Ramsay, Sime, Darby Healthcare. We'll also come back and talk about awareness campaigns within Malaysia, because she works, or rather helps with the Malaysian Epilepsy Society. She's the president there. What plans are being rolled out right now in order to bring about a lot more awareness with regards to epilepsy in Malaysia. Stay with us, we'll take a short break and come back with more right here on Medical Today. Hello Malaysia, and welcome back to Medical Today. We're currently discussing epilepsy and the brain. Joining me in the studio is Dr. Shirini Bazir Ahmad, a consultant general physician neurologist from Ramsay Sime Darby Healthcare. She's also the president of the Malaysian Epilepsy Society and the treasurer for the Epilepsy Council of Malaysia. Can you talk a little bit about the, of course, society, or the Epilepsy Society in Malaysia, and your work there as a president?
Okay, so the Persatuan Epilepsy Malaysia, or Malaysian Society for Epilepsy, is an independent body, and it's been developed or established for many years now. And the main role of our Persatuan Epilepsy is to try to reach out to the public, and most of our members are, most of our members consist of either patients, family members, carers, or anyone who's interested to be part of our epilepsy community. And part of our work is trying to spread awareness. So we've done many programs, such as our epilepsy awareness every year, to reach out to the public, explaining or giving talks to the public, telling them about what epilepsy is all about.
So having awareness campaigns, that's great, but is it gaining traction on a yearly basis? When you come up with a campaign, do you see it gaining traction, as in people, the level of understanding with regards to the disease going higher or coming up?
Okay, so I started joining the society only in 2013. And I remember when I first started to help organizing the awareness program, I think the first program that I organized, I had only about 7 audience, 7. And this year, I had about 50 to 80 patients, relatives, and I even had patients coming out and telling stories and sharing their problem with others. And we have now Facebook, we have Instagram and all that, so people are start sharing information. So I think that we are doing something and we are getting somewhere. Right. However, like all other NGOs, our limitations would be in terms of cost and financial and all that. So we don't even have a building at the moment.
That's always a constraint, but I guess we're with your head in the right place and the right will. I'm sure we'll be able to break ground.
And our previous president, Professor Lim Keng Siang, previously has also helped to organize a support group, which we are having every month.
Right.
So we have a channel for our patients to actually come and share their experience and their problems, because things that they share with us in the clinic is so much different than living with epilepsy on its own.
Now, coming back to epilepsy, let's talk about an epileptic seizure. What are the triggers of an epileptic seizure?
So if someone has the tendency to have seizures, hence having epilepsy, so there are things that I tell my patients to look out for. For example, if you're being very tired, not enough sleep, if you have too much to drink alcohol, also if you miss your medications. Sometimes I tell my patients, if you know that week's going to be very tiring for you, you're going to travel or you have to study late night, those kind of things, so watch out for any symptoms of seizures, or sometimes I may ask them to increase their medication a little bit during this time. Some people know when they're getting seizure, so what we call aura, but some people don't. So those who don't know, these are the ones that kind of a bit of a problem, because they might have complications from having the seizure itself.
Right. So are there any rules or laws with regards to people who have seizures and say operating a machine or driving or just leading your everyday life,
Definitely there is. However, I think our law is a bit different than, for example, the law in the UK.
Right.
So it doesn't specify exactly, but we do tell our patients, and it's stated in the law, that if you are endangering yourself or other people, then you shouldn't be doing that job.
Right.
And each occupation, for example, they would have their own guidelines. For example, people with epilepsy might not be able to be a pilot. They shouldn't be driving public vehicles such as taxi, bus drivers, and they shouldn't be driving if their seizures is not under control.
Right.
So, and heavy machineries is one. Also, if their job involves great heights, climbing ladders and all that, electricians. So these are the things or jobs that they need to be careful.
Now let's take a look at the treatment of epilepsy. How is epilepsy treated in Malaysia?
Okay, so we are lucky in a way that compared to some of our neighboring countries, we do have good access to medications. Except that I think one of our limitations is cost. So some of the medications are, thank you to our government, because they help to subsidize these drugs. However, some medications are still quite expensive and difficult to get hold of. So drugs is one. Okay, so treating epilepsy with medication. There's a number of patients, like I said, can be treated with surgery depending if they have any lesions in the scan, in the MRI, in the brain. So these are the patients that we will work up for epilepsy surgery. First is trying to understand what type of epilepsy they have, and then we have to do a battery of tests. This will include an EEG, which is an electroencephalograph. This is like putting wires onto your chest, looking at your heart rhythm. So the same thing as putting wires on your scalp. It's non-invasive, and what we're doing is just reading the brain waves.
Right.
So we have these squiggly lines that we look at, and then we try to figure out which part of the brain the seizure is coming from. That paired with how the seizure happens. So when patients have epilepsy, we will ask what happened to the arms, what happened to the eyes. So it can be a bit dreading, for patients,
Right.
being asked all these specific questions.
We've got about 2 minutes left. Let's very quickly talk about the stigma surrounding epilepsy. And I know you've seen so much of that stigma surrounding Malaysia. What do we as Malaysians need to know about the stigma with regards to epilepsy?
I think stigma in epilepsy is such a huge subject. Okay, stigma surrounding marriage, education, living with epilepsy, employment. So I think what people need to know, that epilepsy is not infectious. It's treatable. People with epilepsy shouldn't be discriminated. In fact, we should make their life easier. If we think that our employees have epilepsy, we should make the environment safe for them. A lot of them can lead normal lives like just other people. And not all epilepsy is inherited. So people are scared to get married with patients with epilepsy because they're worried that this is genetic and all their children will have epilepsy. This is not necessarily true. So we shouldn't be discriminating them from, relationship, employment, education. If you don't know about epilepsy, learn about the disease. We are here to help to distribute information.
Right. Of course, there lots of specialists who can talk to you about this from Ramsay, Sime, Darby Healthcare. We also have the Malaysian Epilepsy Society and the council, the Epilepsy Council.
The Epilepsy Council is more of a professional body trying to educate professionals, so medical doctors, medical students in this subject, trying to support them from research, education point of view. The Epilepsy Society is more for the public, and we do have our website, Epilepsy Society Malaysia, and we also have our Facebook page that you can visit to understand more and share your questions with us.
Right. On that note, we'd like to thank Dr. Shirini Bazia Ahmad, a consultant general physician neurologist from Ramsay, Sime, Darby Healthcare. Thank you very much, Doc. It was a pleasure speaking to you. You stay with us. We're going to take a short break and come back and find out a little bit about gynecological problems right here on Medical Today. Hello and welcome back to the final segment of Medical Today. We have with us Dr. Gerard Ratnam Sosemutu. He is a consultant obstetrician and gynecologist from Ramsay, Sime, Darby Healthcare, and is here to talk about gynecological disorders. We're talking about abnormal vaginal bleeding. This is a little something which has become quite a topic, especially in the current affairs show in BNC. So we're bringing it to Medical Today. Doc, thank you very much for joining us.
Thank you.
It's a pleasure and an honor to have you here. We've heard a lot about your work. Well, let's just get straight into it. What is considered as abnormal vaginal bleeding?
Okay, to know this better, I think we have to know what is a normal menstrual bleeding. Every woman must get their period every month once, and that will last for about, the normal menstrual cycle will last for about 3 to 5 days, having to change about 3 to 5 pads a day, and it's only partly soaked. So any bleeding, any vaginal bleeding outside this normal menstrual cycle is called vaginal bleeding, abnormal vaginal bleeding.
Right. So when you talk about vaginal bleeding, when can it happen? When does an abnormality come into play?
It can start from any age after the one person attaining menarche. That is, once they start getting the period, it can happen anytime during their lifetime, even after attaining menopause.
Right, but I guess the bigger problem here is it can happen due to many things.
Yeah.
What are the most commonest problems which lead to vaginal or abnormal vaginal bleeding?
Most of the time is due to a simple reason of hormonal imbalances, most of the time. But sometimes we have to think about whether there is any growth in the uterus which is causing this bleeding. Of course, the worst cause will be if there is any cancer in the uterus or ovary, which we are more concerned
So
about.
the first thing you want to do is ascertain if there's a cancer.
Correct, yes. That will be our utmost importance to know that if there is any, must rule that out first. So for that we need to talk to them and try to get some history, the type of bleeding, how long they've been having this problem and kind of things. And from a simple history taking, we should be able to come to a conclusion what kind of bleeding. Right. But if we can't decide on what is the nature of the bleeding, then we may need to do a few tests. It could be like office tests, like simple tests, or sometimes if need to be taken to operation theatre to be done under general anesthesia, we need to.
Right. So a woman should get her menstruation, essentially should get a menstruation once a month.
Once a month.
And the bleeding happens between 3 and 5 days.
Correct.
Okay. And
changing about 3 to 5 pads.
Okay. So saying if you start over bleeding, and maybe if you're using more than 5 pads, 6, 7, correct, then there's a cause for, is it a cause for worry or something that you should check with your doctor?
don't discount it as, you know, nothing to worry, anything. Just approach a gynecologist.
Because most of the time that's the case.
Yes, correct.
A lot of things are discounted.
Yeah.
Oh, you know, I missed my cycle. I think it must be one of those days.
Yeah, don't come to conclusion on yourself. You know, try to go and see a gynecologist and let the doctor tell you that, okay, everything looks all right, we don't have to worry, or the doctor will tell you, let's wait and observe and see. That's a good news for you, you know. So instead of you coming to a conclusion that everything is okay, let the doctor tell you that you're okay, you go home, you know.
Right. So let's talk about investigation again. What kind of investigation is done? Saying if you get different kinds of what do you call it, experiences or what women come up with as complaints, how do you investigate?
We first of all, investigation includes the the questioning sessions. Then after that, probably an ultrasound examination. Then pap smear, it's an integral part of our examination. We always insist the women to have a pap smear done every year.
Right.
And then we try to stress, you know, so for our present days young women, it's a bit difficult to fit in this medical care in between their busy career.
Right.
So I always try to tell my patient that try to get these things done during your birthday time. Like say if your birthday coming, you try to fix that 1 week before your birthday or 1 week after your birthday to remember, okay, you have to go and see a gynecologist, have a date with your gynecologist.
Gift yourself with a life-saving test.
Correct, yes, yeah, that's right. So every birthday, don't forget to go and see a gynecologist also.
Right.
Not exactly on the birthday. You have to spend time with your husband and family.
I have spoken to women, of course, you know, why do I have these conversations with women? Because, you know, by and large, I work as a journalist and we talk to them.
Yep.
And some women in their 30s have not had their pap smear done.
That's why, actually, contrary to think, we tend to think that nowadays the women are more aware and then we don't have to talk pap smear. But I insist that every time I go for a forum or talk, I insist on this pap smear and get it done. And if the pap smear is normal for 3 consecutive years, then the doctor is going to tell you, no, you don't need to come every year to see me. You come only 2 years once to do the pap smear, or even 3 years. Unless you have any other issues, you don't have to go and see the gynecologist in between.
Right. Here's a question with regards to abnormal vaginal bleeding and women in different eras of their life, say in their teens, in their 20s, in their 30s, can the abnormalities manifest itself differently?
Can you please repeat?
Okay, so saying in your 30s you have abnormalities and in your 20s you have abnormalities.
Correct.
Can the symptoms be different?
Yeah, in 30s, most of the time it is not due to cancer. So it is mostly due to hormonal imbalances and kind of things.
Right.
But when it comes to 40 and 50, the first thing we will be thinking is whether you have cancer or not. First thing, whether cancer of uterus, cancer of cervix, or cancer of vagina. And
Right.
things.
So with abnormal bleeding, does it always have to be treated?
Not necessarily. Sometimes after the examination, the doctor will say, no, everything looks all right. We can observe whether the problem recurs again. If it doesn't, it's a good news. If it happens again, then probably the doctor will decide to take it further. Like I mentioned, maybe a total examination under anesthesia in theatre. Yeah.
Right. Another thing we want to talk about today is intermenstrual bleeding. So from cycle to cycle, there's another bleed in between.
Correct. As I mentioned, one's supposed to have their menses only once in a month. And if somebody has the menses in between 2 cycles, that is abnormal, considered abnormal. That has to be examined properly and establish the cause why it is happening.
And what could be some of the reasons?
Hopefully it is due to hormonal issues, as I mentioned earlier. But as I mentioned, we always want to make sure that it is not anything cynical.
Right. Now, while you're having a good time, sometimes you bleed. So postcoital bleeding is also becoming a subject of
course. That is actually an alarm bell. If during a sex or after sex you notice there is a bleeding, noticed, that don't take it easily. Go and see the doctor immediately.
So after sex, if you're bleeding,
Abnormal,
it's
totally abnormal.
It's abnormal. It shouldn't
go
happen.
and see the gynecologist, and he will probably have a look at the cervix and will do a pap smear and wait for the report.
From your experience, why does this happen, postcoital bleeding?
We have to think about cervical cancer straight away.
Straight
away.
There's dryness, so on and so forth.
That will be a good news. In fact, yeah. First, we would like to do a pap smear and make sure the report comes back as no cancer.
So, if you're sexually active, the advice is if you have postcoital bleeding or bleeding just after sex, you must go and check immediately.
Must.
Now, here's the million-dollar question. Most of us go to our primary healthcare providers, which means we go to the clinics around our taman, so on and so forth. So when we go and see a general physician, will they refer straight to someone like
Usually, if you say postcoital bleeding, the doctor will get alarmed and he will straight away tell you to go and see the gynecologist.
Right.
Postcoital bleeding, most of the time than not, it is something to do with the cervix, and it is cervical cancer.
Right. A lot of talk, there's been a lot of talk out there about the HPV vaccine. Of course, there's a group of people who are not into vaccines, so let's not talk about them. But the HPV vaccine, by and large, there's been a cry for women to go out and get vaccinated. But there's also been talk about the HPV vaccine. If you're sexually active, then the vaccine doesn't work on you.
Not really.
Not really.
HPV vaccination is a wonderful invention, I will say, something which prevents the cancer from happening. Not many cancers can be prevented, but with this HPV vaccination, the cancer can be prevented 90% of the time. So there is no such thing, fact that it doesn't work for sexually active people. Anybody who has started engaging in sexual act should go for this vaccination. And I suggest when the best time to give is before the child start having sexual intercourse, should be given this
right, but I guess, as parents, some of us are afraid to, even think about these things happening. Yeah?
That's why actually we all are talking about sexual education. Talk to your children about sex education so that they are aware what is good for them and what is bad for them.
Right.
And vaccination is definitely, this vaccination for HPV is definitely a good thing we can do for our child. And it is expensive. It is very, very expensive, I'll say. Each dose comes to about 500 ringgit or anything.
Right.
Not
and
many
this
people.
vaccine needs to be taken.
It's about 2-3 times. If you are doing early, about 10 years old, before 12, then you just need to take 2 times.
Yeah. At
Otherwise,
what age do you start?
You should
the
start giving by 11, 12 years of old. But
right.
now in government schools, they are giving for Form 1 students. But if you are if you have missed that part, the vaccination, then I think you should go and get it done. Of course, the money is a problem, but
right. Off the air, you were talking about it being a gift from the family.
Correct. I always try to stress this point that since it will cost about 1,500 ringgit, if I'm not wrong. So why not like if we go for a birthday party or something, a group of us can pool some money. And then instead of giving individually some gift or something like that, we give, okay, I'll give you a check for 1,500 ringgit. We 3 of us or 4 of us joining together, use this money for the vaccination. That'll be a wonderful idea.
That is a wonderful idea. But just imagine going to your friend's house and then telling your friend, Macha, I've got a HPV vaccine package for your daughter, and they'll be baffled. Is our society ready for stuff like this?
You will be surprised, actually. People are aware of this vaccination, and many people have got no access to this purely due to financial reasons.
Right.
And there is no excuse. And people are aware of all these things nowadays. Yeah.
So I guess your awareness campaign, or as an individual, and also a specialist in your area, which is an obstetrician and gynecologist, you always push for pap smears and vaccines. That's what you always talk about.
Definitely, most of the time. Pap smear is a must. We always ask these questions. Have you done a pap smear? When was your last pap smear? And to my surprise, even many of them will tell us what is pap smear. So even just now off air, I was talking to our staffs here, and there were some of them, they didn't know what is pap smear. So we better don't deny the fact that many people are not aware of pap smear. It's a wonderful
is that, a new
test.
coffee shop?
Yeah, exactly. It's a wonderful test.
Right.
Every woman should go for this.
In closing, very quickly, we've got about 2 minutes left. Your thoughts on post-menopausal bleeding?
Post-menopausal bleeding we are seeing increasingly nowadays. That is bleeding which happens once you are already menopause. After about 6 months after reaching menopause, you are not supposed to have any more vaginal bleeding. And if you happen to have a staining or spotting or bleeding like period, you go and see a doctor because it can be a uterine cancer. The doctor tend to think the first thing why there is a postcoital bleeding is uterine cancer.
Right. So every time there's an abnormal bleeding, the first thing they think about is uterine cancer.
Yes, after your menopause.
After your menopause.
Yes, correct.
Well, with that, Doc, we'd like to thank you very much. But before we go, if you have any questions for Dr. Jiva and all the specialists that have been on the show, send it to us. Send us an email. Send it to ask@medicaltoday.my. That's ask@medicaltoday.my. And when you send us your question, we'll furnish you with the answers and a bottle of vitamins courtesy of Pharmaniaga. On that note, we'd like to thank Dr. Gerard Ratnam Mutu, a consultant obstetrician and gynecologist from Ramsay, Sime, Darby Healthcare, talking to us about abnormal vaginal bleeding. And more importantly, don't forget to get your pap smears done. If you don't know what a pap smear is, go find out.
Yeah, if you have young daughters, please get them vaccinated.
Please get them vaccinated. It has to be done soon. This awareness campaign should go on. On that note, we'd like to thank you for joining us on today's edition of Medical Today. Have a fantastic weekend and a great week ahead.